Good afternoon, everyone, and welcome to this joint committee meeting of our Government Operations and Fiscal Policy Committee and our Health and Human Services Committee. Today, we have one official item before us, which is an FY24 amendment to the budget of $200,000 from MoCo Pride. And I've already discussed it with my co-chair, Councilmember Albanaz, since we also have a request from some council members to consider a $500,000 appropriation for the FY25 budget, and we thought since we had all these amazing people here, our experts, that in the half hour we have before each of us have other committee meetings, we were going to try and do both here. And I also want to welcome Councilmember Glass, who is joining the joint committee meeting. And so to kick us off, Ms. Cummings, I think I'll pass it on to you, and I know we have lots of great people here, so I don't know if people want to make their way closer so we can ask questions or things, but Ms. Cummings, if you want to start with the appropriation.
Thank you, Councilmember Stewart. Thank you, Bessie. So today we have supplemental appropriation 2473 to the FY24 operating budget. In the amount of $200,000 for the Department of Health and Human Services for empowering communities through MoCo Pride Center Incorporated. And this is connected to a Section G non-competitive contract award for the same amount. So the purpose of this Section G amendment is to provide for the support of safe spaces and social services to support LGBTQIA+ communities in Montgomery County. While the scope of the work that this funding would support is still being determined, it's anticipated that it will support at least 3 Live in Your Truth nights and a back-to-school party. So just to briefly give a little history and context, MoCo Pride Center Incorporated is an umbrella organization for other LGBTQIA+ organizations that operate in Montgomery County, including Trans Maryland, Live in Your Truth, the Coalition for Inclusive Schools and Communities, amongst others. At the core, the goal of their programming is to create and support inclusive programming and events reaching LGBTQIA+ and intersectional underserved communities in Montgomery County. And integrated into their programming and services are linkages, comprehensive linkages to care, economic empowerment, and inclusive programming. MoCo Pride Center currently is receiving $30,000 in county funding in FY24 through a competitive contract for the Pride in the Plaza event. Currently, there is no recommended funding in the executive's FY25 operating or capital budgets. That being said, there was a memo that went out to the HHS committee on April 18th from Council Members Stewart, Mink, Glass, and Balcombe, requesting an addition of $500,000 in additional appropriations for FY25 to support the programming and services of MoCo Pride Center. MoCo Pride Center's programming and their events that provide safe spaces and social services support the findings of the Montgomery County LGBTQ+ community survey and the OLO report on transgender healthcare in Montgomery County, both which recommended a dedicated, safe, and affirming space for LGBTQIA+ community members. In FY 2023, HHS held a $30,000 competitive contract with MoCo Pride Center for the Pride in the Plaza event. This was renewed for this year for FY24, and it was a one-time renewal, and it cannot be renewed past June 30th, 2024. So for next fiscal year, Health and Human Services must resolicit the services under a competitive contract. So through working with MoCo Pride in the Plaza, HHS is able to gain a pathway into providing sexual health and wellness services, including increased HIV testing, HIV care engagement, and opportunities for PrEP uptake for priority populations that have been identified in the county's plan to end HIV in Montgomery County. Through the last 2023 MoCo Pride event, DHHS was able to reach over 1,500 community members. I did just want to briefly note that on April 16th, there was a public hearing, and we received several pieces of public testimony in support of this appropriation and future funding. This supplemental appropriation is funded by general fund reserves and was not assumed as part of the executive's FY25 budget submission. The approval will impact the current projection as of March 14th for FY24 by reducing the general fund reserves of 15% by 0.006%, and the same reduction would apply for FY25 as well. The Office of Racial Equity and Social Justice did release a memo on the supplemental appropriation, and I did leave the full memo up on your desk, but there's a summary in the packet, and they found that this appropriation has the potential to help address racial disparities experienced by LGBTQIA+ individuals in Montgomery County. And they did also share that a more comprehensive review of the local LGBTQ+ community ecosystem and its connection to county resources may be beneficial to fully understand how the funding will directly impact racial equity. So with that, Council staff recommends the approval of the supplemental appropriation and the associated Section G amendment. We did just want to highlight a few questions that it may be helpful to clarify how much of the FY25 anticipated expenditures would be addressed through the FY24 appropriation, just if there's any overlap between those, or if is the expectation that DHHS and MoCo Pride have identified $700,000 of expenditures between the end of FY24 and FY25. Thank you.
Great. Thank you, Ms. Cummings, for that. I do want to say to my colleagues, if you have a question or want to speak, just either wave to me or text me, because everybody's sitting in a different seat. I thank you, Dr. Ashford, for being here, and Mr. Philip Alexander Downey, thank you for being here as well. I didn't know if either of you wanted to say something before we got into questions from the council.
The only thing that I would note is MoCo Pride has been an amazing partner with helping our STI clinic and our team, Melvin and Emily, actually reach clients and deliver the services that we provide, whether it's STI testing or PrEP. And so it's been a great partnership, and they have really helped us target our services to the community members that need them the most. So that's what I would. Thank you.
Great. Wonderful. Philip?
Thank you all so much for having us. And I just wanted to point out that our work is really focused on those communities who are most marginalized, underserved, and disenfranchised. We focus to try and ensure that people have access to the myriad of county resources that we have here, but that are not always accessible to our community members for various reasons. So thank you all so much.
Great, thank you. And I do want to notice in the packet Ms. Cummings put together, which was an excellent comprehensive packet, that we also had a memo from Emily Brown in the HHS department talking about our goals specifically on HIV testing and STI, and thought that was very helpful to put this all in context. I see the first question I have is Councilmember Lukey.
Thank you. The only reason I didn't sign the memo was because it was to myself as a member of the HHS committee, and so I had a conversation with Chair Stewart saying, I think I'm not supposed to sign it because you're sending it to me, but certainly supportive of all the work that you do, the very good work that you do. My question is actually about the request for FY25. And obviously, and I just made this assumption, so I want to give you the opportunity to tell me if I am correct, that the reason the supplemental for FY24 is necessary is because the different series of events that will be coming up require procurement, planning, and outlay of expenditures prior to July 1st. Is that right?
That's correct, yes.
Okay. And then I guess this is a question more for Dr. Ashford or Dr. Stoddard, but in terms of for FY25, because as I understand it, there's a contract being worked out now for the remainder of the things that are going to be funded with the FY24 supplemental, but for what we are all thinking about under the FY25 necessity, and not wanting things to stop, right? Is that something where the executive branch just didn't have time to put that together yet? Were you looking at scoping out what that would be? Why, sort of, since it wasn't in the county executive's budget, but these are typically ongoing things that the county relies upon MoCo Pride to do?
I'll take that. So, so first off, as you've already heard, I think MoCo, the Pride Center is a wonderful partner for our Health and Human Services Department. It provides access to the LGBTQIA plus community in ways that other the government often doesn't have the connections that community partners often do. And that's true in this example as well. And so when we received the report in January on trans health, and obviously it created a much broader conversation, and a conversation that was going to take more than the time between January 15th and March 15th to fully complete. And so our intention always been to come back to the council to seek additional funding, not potentially just for the Pride Center, but potentially for other activities within the trans health space. We want to have a more holistic answer to the questions that are raised by, and I think you see this with the CCI Center supplemental request, or the funding request for the Capitol. There's an ecosystem issue that we need to address. And it will not just solely be solved by the work that we do with the Pride Center, nor with just the work that we do with CCI. And so that's, I don't think the executive has any objection to additional funding for the Pride Center, but obviously the reason we wanted to have a little more time is because we want to, frankly, have a more holistic answer to the questions that we're getting about trans healthcare. So. Sure,
but I mean, if were we to move forward with both the FY24 supplemental and, of course, the proposed FY25 conversation and funding, that the county executive branch would, in fact, make sure we had it all documented and scoped out.
We can, yes.
Okay.
And so I think the nice thing is that the work that the Pride Center already does with Pride in the Plaza, this is really an extension of the same kind of activity, meaning a convening event that brings people together, that gives us access for healthcare and, frankly, other purposes like housing and other supports that the county offers. So we would just build out a longer program of implementation should the council fund an FY25 proposal.
Great. Thank you so much.
Great. Any other committee members have any questions or comments? All right. I'll turn to Councilmember Glassman.
Thank you very much, Madam Chair and Mr. Co-Chair. This is a great day. I also want to acknowledge Lee Blender with Trans Maryland for just joining us as well. I very much appreciate that the series of funding that you've proposed and has been explained, right? We're a month away from Pride, and everyone will get a lot of information about what you all are doing, and all the events are taking place around the county. A great reprieve from the budget, a great celebration after the budget. And so to be able to prepare for that, I think is great. And not only to have this amount of money being proposed as a special appropriation, but then have it built into the budget so it is ongoing, especially key. And so for all of us colleagues, while the order might be a little different, we support this special appropriation. We have to commit ourselves to supporting the budget item. Otherwise, it is Lucy pulling the football, and nobody's interests are served there. So this is a dual commitment that we have to make. And last thing I'll just say, when I first joined the council, and Councilmember Albernaz will remember this, when I was on the HHS committee, I was looking for a policy to lead, and ended up for 4 years leading the homelessness and vulnerable community space. And one of the reasons, let me rephrase that, the reason that I first picked that is because I learned that at that point in time, the county had committed about $500,000 to create an LGBTQ youth space, geared mostly towards homeless youth. And then those of us who've been here a few years remember that a week or two later, we had to cut the budget by tens of millions of dollars, our first official act of that council. And so that money went away. And so this conversation, this activity, and this pledge to the LGBTQ plus community and their family members and loved ones is a long time coming. And so I very much appreciate our community and organizational leaders and those in HHS who help put Pride in the Plaza together and all the other activities as well. And we're going to keep doing good things and make sure that everybody feels welcome, loved, and respected here in Montgomery County. Thank you.
Thank you, Councilmember Glass. Councilmember Mink?
Thank you. I agree with all of that. Yeah, this is really important, and this is a long time coming. And so I want to also really appreciate Chair Stewart and her staff for really, really important, critical work, putting these the details of these proposals into perspective and moving the related letters and having some really doing some good digging and bringing together some important information for us to all be able to really make a holistic decision about how we're going to fund these priorities, looking at the long term, not just kind of these little stopgap band-aids along the way. You know, I'm remembering a conversation that I had with Mr. Downey around this time, a little bit later last year, in the wake of Pride in the Plaza, in which we were talking about the difficulty with paying out for you know, vendors, for people who had participated to support the, you know, artists and many different people who participated in putting together an event that all of us celebrate, and we all go there and we take our selfies and we talk about how important it is. You know, it's an event to Dr. Stoddard's point that helps us connect people to services and to do the work in healthcare and housing and other urgent work that we have to do in this very vulnerable community. And meanwhile, we have folks at MoCo Pride who were struggling to pay out the people who had worked to put that event together, and, you know, going into their own pockets to make sure that people were being paid because, you know, the procurement process is long, all of these different complications that come when we don't have adequate funding in the base budget. So that is really an unacceptable situation, and I'm grateful to all the many conversations that have taken place between then and now to put us hopefully in a different place moving forward. I think that is absolutely both the right thing to do and also the responsible thing to do from a fiscal perspective.
Thank you. Councilmember Sales, did you want to?
Thank you, Madam Chair, for the opportunity. As the lead for eliminating disparities and health disparities, I appreciate all the initiatives in the county to address the disparities and inequities that our residents face. And as we've deliberated the budget, we've had many discussions regarding one-time funding classifications. I think Councilmember Glass just alluded to this, and our grant process and how these funds are being used, and how we need to prioritize ensuring sustainability to continue providing the best support to these initiatives. And there's no doubt we need more resources for the LGBTQIA+ community in our county. And as we expand and fund these resources, I am requesting that within these initiatives, we are ensuring that our Black and Brown LGBTQIA+ residents are equitably receiving benefits to these initiatives, given that the same disparities that exists within, that exist outside of this community exists within our entire county. And so I am really excited about some of the initiatives about all the initiatives that are being proposed, and I'm glad to learn that MoCo Pride has partnered with the county to support the pillars of the county's plan to end HIV in Montgomery County. And I know I asked this in our last session, but do we have any data on how many individuals have accessed these resources at the events, and were they unique versus duplicative? Do we know what those numbers are?
Yeah, so I'm going to call Emily Brown, our program manager.
Press your button.
I'm sorry there.
Yeah.
I'm sorry. I'm going to call up Emily Brown to join me, our program manager for ending the HIV epidemic. We do have demographic data. Not sure she has it with her. Oh.
Yes, Dr. Ashford has.
Emily, please feel free to also come to the table.
And I do think there's some information in your packet starting at circle 8, but Dr. Ashford, if you want to walk us through some of that.
Sure. So last year at our Pride in the Plaza event, we had 127 HIV tests. To your point, Councilmember Sales, 37% of those were administered to non-Hispanic Black individuals, 3% were non-Hispanic Asian, and 38% were individuals who identified as Hispanic or Latino. When we look specifically at our Black and Latino women, 47% of those tests were for Black and Latino women. Now, because of the intersections, there might be some duplication there, but the vast majority of individuals who received the services were our Black and brown residents.
Oh, okay. Yeah, it would be helpful to just find out what the unduplicated information is so we have a better idea of how many people we're actually serving individually.
Yep, we can get that to you.
Thank you. Okay, and then the Office of Racial Equity and Social Justice notes that a more comprehensive review of the LGBTQ plus community ecosystem and its connections to resources would be beneficial to understand how this funding might directly impact racial equity. And I don't know if there's, if that's what this was for.
That is the full memo from ORESJ. My apologies, I didn't include the full memo in the circle, so I just wanted to make sure you
no
had
worries.
it.
Okay, thank you. And then the events, Living Your Truth Nights and the Back to School Party, are these the first year that these events will be held, and how will you be measuring success for these events?
I can take that. This is not the first year they've been held. This will be the second year that our Living Your Truth Nights and Back to School Block Party will be held. There was an average of around 250 people at each program. We did, and I believe, if I'm not mistaken, and someone can correct me on the statistic, there was about 25% of those individuals did get tested each night, which was, or 20%, which was wonderful. And we, like I said, we focus on our intersectional BIPOC communities. And that's because we know that when you are taking a bottom-up approach, you kind of raise the tide with everyone. And so like I'm not sure if we have demographic information on that, which is that Melvin or Emily? Do we have demographic information on the Living Your Truth Nights? Okay.
Emily.
Oh, there's one more seat at the end, Emily, if you want to.
This is not going to be a very satisfying answer, which is that we don't have data for those events the way that we had testing data for Pride in the Plaza, because we partnered with our federally qualified health center partner, Mary Center, to provide that testing. And so whereas we have easy access to our own testing data, we do not have access to theirs readily. But the demographics, I was there every night, were very similar, and these events immediately preceded Pride in the Plaza. So these were really similar kind of community vibe and similar arts and culture entertainment. And so we were really hoping to build up to Pride in the Plaza with these events. So I don't have numbers, but that's because we were engaged in a wonderful community partnership.
Good. Well, with the people that we partner with, we want to make sure that, especially when we're using taxpayer dollars, we're tracking the data so we know exactly who we're serving and we can speak to all of the gains, because we're going to be in another meeting and I'm going to ask our director of the HIV/AIDS program, and he's going to want to have that information when he comes before our committee. So any partners you're working with should follow our lead and our expectations on data collection. Everyone has to check in and register, and they should be able to share that information. So, and then the back to school party, is this the first year or second year?
This will be the second year it's happened.
Okay.
I can't tell you the demographic information on the free meals that we gave out, but I know we gave exactly 100 free meals out last year. That we worked with a corporate partner to provide those. In addition to that, the caveat for those free meals is that we were also having a group of young people do HIV and STI education, and so that's how we were able to partner with that individual to ViV to healthcare to get that to get the meals provided, in addition to hundreds of school supplies that were given out that day as well. So like I said, we did not track, but we'll be sure to track them this year, as we know we'll be partnering with you all.
So not just tracking the demographics, as we should just make that, a foundational requirement. Just thinking about the school environment and the challenges that our young people are facing in the school and trying to build community within their community. I would love to hear more about any ongoing efforts to keep those connections past back to school. Like, are there opportunities to stay engaged with the community and make sure that they continue to have access to resources? Because, it's one thing to have a great event at the beginning and then we'll see you next year. So I'd love to hear more about how we're going to continue to engage that community throughout the school year.
Wonderful. Thank you so much, Councilmember Sales. We are really focusing through the whole MoCo Pride family around maintaining connections and building and growing them. So connecting in through our schools, especially with the GSAs, continues to be a extraordinarily important focus for MoCo Pride family. Our young people really need us right now, especially with the national environment. So that is a top line priority, especially also focusing on Black and Brown LGBTQI plus youth, as Philip mentioned.
So is there more information about how you're going to keep in contact past the initial event?
So MoCo Pride family maintains, connections within the school system, and so prioritizing connecting in through to GSA programs so that we have that available information. One of the difficulties is really that because of the national rhetoric that's going on, there's a lot of fear and concern with folks.
Yeah.
So it's often a challenge to provide information and resources and make them very broadly available. In theory, every school could have their GSA's information posted very prominently. However, safety is of concern. Gender and Sexuality Alliance. So for us in the older days, it might have been Gay Straight Alliance, and so the updated version, as language evolves, it became Gender and Sexuality Alliance. Yes.
Okay, because we're equipping our schools to have these wellness centers, and they should be inclusive of all of the information necessary to support all of our students in our schools. And so I don't know if there's a listserv that they can subscribe to continue that community and that exchange of information and resources, and have that communication channel stay until throughout the year.
So we do connect with them. Thank you so much for bringing this up, and I'm glad that you pointed this out. So the Coalition for Inclusive Schools and Communities, that work is specifically geared towards our young people and showing up and having a presence in schools. We attend the monthly Pride Alliance meetings that are held with the schools so that we can hear from them. We are often just silent.
MCPS wide?
MCPS wide, yep. We are often silent. Individuals there just listening so that we can relate back the problems not only to you all as our partners, but to our consortium of organizations to try and meet the young people where they are. We also have a spot for student members of our board of directors for the MoCo Pride Center, and so we actively engage students and young people to be a part of the learning and planning process and advocacy process. And so the coalition really is focused on not just maintaining those relationships, but making sure that we are a listening partner. And of course it's all volunteer run, and we're trying to ensure that there are that we are focusing on our on the problems that the young people face by providing, sometimes just an ear, but sometimes like more advocacy, like showing up when Moms for Liberty are actively protesting LGBTQ students in places. And our Drag Story Hour program, we have those monthly programs. They are literacy programs. And this year, Pride in the Plaza, we are planning to have Drag Story Hour in Mandarin, Spanish, as well as English. And so those monthly programs are another way that we keep up with young people and families.
Awesome. And then one last question, Madam Chair. The FY25 request is one time or ongoing, or we haven't made that decision yet?
Well, ideally, we would like this to be an ongoing partnership so that we can build a sustainable foundation for a sustainable future.
Yeah, I think the point I would just make, and my colleagues who also wrote the letter, is that all that Mr. Downey just talked about and Lee talked about are things that the MoCo Pride Center is doing now, and other than the $30,000 contract for Pride in the Plaza, there is no other support from the county going. So I think that was the initial request for the supplemental, and then as Dr. Stoddard said, there is more work we need to look at our entire ecosystem, but understanding the critical work that's done. And again, thank you to Ms. Brown for her memo and Dr. Ashford for going over our goals on HIV testing and STI testing, and even in the chart of like where we need to do better on our PrEP coverage. We have a goal of getting to 50% by 2025, and the last count we were only at 25%. And so making sure that we're reaching our communities, that's the reason why we put in the request for the FY25, to make sure that there was no disruption, and that the MoCo Pride Center could continue to hold these events, do its work in collaboration with HHS as we're figuring out the larger ecosystem.
Oh, okay, thank you. And then did we have a budget breakdown accompany this $500,000 request?
We don't. We can get it to you later, but
Okay.
We were looking to provide more funding in different places for organizations, and because of unfortunately, we've been getting bomb threats with Drag Story Hour, and we've had to repurpose funds and kind of say where are our priorities at. So we have to have heightened security in some places, and so we can get that for you.
Yeah, it would be helpful to see, how the money's being used and what the proposal is for next year. All right, thank you.
Great. Councilman Ravenos, did you? All right, so I guess the first thing is let's deal with FY24. So all those in favor of recommending the supplemental of $200,000 from MoCo Pride in FY24, please raise your hand. And that's unanimous of the two committees. And I don't know, Councilmember Albanaz, if you want to speak to, since that's just HHS making the recommendation on the other.
Yeah, so, well, first of all, I echo all of the comments, and I've been incredibly impressed with your all's work. I've seen it up front. It is extraordinarily important, and for all the reasons that were so beautifully articulated during our last work session, but also by our public during public testimony, there's never been more important than right now to let our community know that they are welcomed and that we are so happy you are here, and we're going to do everything we can to support you. And so I proudly move that we move the additional amount as well.
And I second. I like you, but you're not on HHS. So I'm going to second it.
But he's president.
That's right. Great. So,
right.
And that is
So
without
HHS,
objection.
so
Yeah.
we can put that on the, and I think, and we can add the GO committee if you want to.
Fine with me.
I agree.
I agree. So we could have both the committees recommend this, and I know we're short on time today because it's budget season, but I know all of us could probably spend the entire afternoon speaking with each and every one of you about these services. And I just want to say thank you so much for the work you have been doing and the work you will be doing in our community, and to our wonderful HHS department. Really looking forward to building on the last couple of years, as Dr. Stoddard said, we have a great foundation on the work that has been done, the community survey with our LGBTQIA community, the OLO report on trans healthcare, and I really feel like we're in a great position to look at how best we serve our community, and really looking forward to this partnership. So thank you all. And with that, the Government Operations and Fiscal Policy and HHS Joint Committee meeting is adjourned, and I believe HHS and EC is here, T&E is upstairs, so depending on who everybody else is here for,